welcome to our COVID support webinar for an update in relation to the recent announcement for Plan B restrictions under the COVID-19 response Autumn and Winter Plan 2021 to 22. Our focus during the webinar here today is to provide you with an update on the key restrictions introduced since the 10th of December and to explain what impact it may or will have upon your business. I will also be providing you with details of our COVID winter compliance grant that is available to you all and details as to how the local authority can offer you some support. If you wish to submit questions to us after this webinar, please contact us on our email address at covidbusinesssupport@wolverhampton.gov.uk. An officer will then make contact with you to offer you some support and guidance. Our Trade with Confidence page also holds a wealth of information, and an FAQ document will be available for you afterwards, detailing the new requirements and including an example of questions asked of us so far. Now, the COVID Winter Compliance Grant. I wanted to start off with providing you with the details of our COVID Winter Compliance Grant that is available to you all to support you with what I'm about to discuss with you in further detail. We have been provided with additional funds to be able to offer businesses with support to purchase essentials or to even help towards extra staffing levels during the busy festive period. The grant is an extension of our previous scheme that many of you have applied for over the summer months, but has been increased by £1,000, meaning that hospitality venues could be eligible for an additional £2,000. You will need to be COVID compliant to be eligible, conforming to the new requirements and government guidance to protect yourselves, your staff and your customers. Those of you who have applied before are also eligible, and the process will involve an environmental health officer as previous, making contact with you to run through your COVID-19 risk assessment, safe control measures and to offer you support as and where needed. Now, Plan B. What are the key confirmed changes with Plan B? There is now a requirement for COVID-19 pass or equivalent proof of vaccination or testing to enter certain venues or events. There is now a change to the self-isolation requirements for all variants, with a move to a 7-day LFD test for the fully vaccinated. And face coverings are also now legally required within relevant venues and enclosed spaces. And as you're all aware, home working is now strongly advised where possible. Now, why have these changes been announced? These changes have been announced in England in response to the risks of the Omicron variant. As you are aware, there has been a spike in hospitalisations and daily infection rates. Government is doing all they can to protect any further undue pressure on the NHS. Now, where is a COVID pass or equivalent proof required? Venues and events where the COVID NHS pass or equivalent proof of COVID-19 status must be used as a condition of entry are in Category A, which are nightclubs, dance halls and discotheques. Other late night venues where all of the following apply. Where the venue is open between 1 and 5 AM and it serves alcohol after 1 AM and it has a dance floor or space for dancing, and it also provides music, whether live or recorded, for dancing. Category B, which is indoor events for 500 or more attendees, where those attendees are likely to stand or move around for all or part of the event. An example would be a music venue with standing audiences or large receptions. We then have Category C, which is for outdoor events with 4,000 or more attendees, and these attendees are likely to stand or move around for all or part of the event. We then have Category D, which is for events with 10,000 or more attendees, whether indoor or outdoor, such as sports stadia and music events. Live music venues and theatres which are indoors with 500 or more capacity, with people expected to stand or move around for the majority of their time spent at the venue, are also required to have the COVID pass checks. Now, which venues are required to make 100% checks? This applies to nightclubs, dance halls and discotheques, other late night venues which fall under the following. You're open between 1 and 5 AM. You also serve alcohol at 1 AM. You have a dance floor or space for dancing, and you provide music, whether live or recorded, for dancing. Those of you who fall under other late night dance venues may choose to check either via checking all of your visitors for the time that you open, both before and after 1 AM, or by checking all visitors who remain in the venue immediately before 1 AM and use the provision of door checks for new entrants from this time onwards. We strongly advise that you carry out your checks at the time of entry as you would with ID checks, checks for weapons and any bag searches. Now, which premises or events are exempt from entry requirement checks? For premises, if a Category A premises does not provide music for dancing or space for dancing, they are exempt. A premises which is hosting an exempt event, live music venues, theatres or concert halls which are indoors, hold 500 or more persons, and these persons are not expected to stand or move around during all or part of a performance. And other sites such as casinos, cinemas and museums, unless they hold an event which meets the expected criteria. Events which are exempt are wedding ceremonies and civil partnerships, but not the reception. A significant life event such as a christening, communal worship, funerals and commemorative events, events which take place outdoors in public space and are not charged nor ticketed, events in private houses, including private gardens, where people do not have to pay or hold a ticket to enter. Now, how are events defined? I'm now going to explain to you the categories of events and a few examples of when you will or won't need to apply certification checks. As I mentioned earlier, events are put into 3 categories under the regulations. You have category B, C and D. Activities and other hospitality venues, including restaurants, cafes, bars and pubs, do not have to use COVID-19 status checks as a condition of entry unless either of the following apply. Where someone rents the venue or part of your venue to host an event that falls under category B, C or D, which meets the criteria for mandatory use of COVID-19 status checks. Or when the venue hosts an event which meets the criteria for mandatory use of COVID-19 status checks and which is ticketed or paid for. Now, examples. You are the responsible person for a pub which has music but no dance floor or space for dancing. You are therefore not required to use the NHS COVID pass as a condition of entry, as long as you do not hold a specific event that meets the attendance threshold of 500 or more people who are standing, such as a ticketed gig. If you are a responsible person for a venue or an event in which a wedding ceremony is being held, you will not be required to check the NHS COVID pass of attendees. However, wedding receptions and receptions celebrating other significant life events which meet all of the following criteria will be required to use the NHS COVID pass. where the reception meets the attendance thresholds for certification, either by being attended by 500 or more people in the case of indoor events, or 4,000 or more in the case of outdoor events, and those attendees are expected to stand or move around for all or part of the event. The reception is organised by a person or organisation operating in a professional capacity, or the wedding reception is not held in a private dwelling. If the wedding ceremony and the reception are combined and proof of vaccination, testing or exemption is required at the reception, attendees are required to have proof of COVID-19 status for the combined event. An example, you are the responsible person for a wedding ceremony and reception. You have organised them in your capacity as a professional wedding planner. The ceremony and reception takes place in the same venue with no separation between them. There are more than 500 guests and it is indoors with assigned seats. In this case, this wedding would be required to use the COVID pass checks. Another example, you are the owner of a hotel. A couple who are getting married hire a large function room from you. The couple are organising the ceremony and the reception for their own wedding. The ceremony takes place in the church and the reception, with 500 attendees, takes place within your function room. The wedding ceremony is exempt, as the couple are the event organisers for their reception afterwards, are not operating in a professional capacity. Therefore, the reception would also not require use of the NHS COVID pass checks. Now, spot checks and events. Am I required to undertake 100% checks for an event that falls within the category B, C or D? In limited circumstances, no, you are not, but you must seek prior approval from the local authority and meet a criteria before applying. I remind you again of the events applicable. It is an indoor event with 500 or more attendees expected to stand or move around, or an outdoor event with 4,000 or more attendees expected to stand or move around, or any event with more than 10,000 attendees. Now, you also need to look at the majority of for these events. The majority of attendees are expected to move around for a fixed start time, where entrants are likely to all arrive in a short space of time. And if it is not possible to set up checkpoints away from your entry point, and carrying out a check on every person would lead to crowd gathering outside the venue or event, and if that crowd would either present a risk to the safety of the persons in the crowd or to any other person, or provide a potential target for a terrorist action. In these circumstances, if it is not practical to check 100% of attendees, you must carry out an assessment of the risk and determine the percentage of checks that can be safely carried out, including taking into account any guidance issued by the government that is relevant to the event or venue. The responsible person must submit this recent assessment of risk to the local authority, and this must be at least 10 working days in advance of the event. One submission per event is applicable for review. The team will respond as soon as possible, but by no less than 5 working days before the date on which you wish to admit people to the venue or event. For events that are due to take place or admittance into a venue before the 31st of December 2021, the written description of the assessment must be made as soon as possible for the event. Please do note that the officer who assesses this assessment of risk will either agree it, propose recommendations for conditions to which you will agree, or they will decline the event. In the event of a decline, you will therefore be required to carry out 100% checks, and please note there is no appeal process to this decision. Details as to where to apply will be provided via our FAQ document and of course on our Trade with Confidence page. Now, COVID-19 status checks. This means any of the following. It is where a person is vaccinated with 2 doses of an approved vaccine or one of the single-dose Janssen vaccines. They have taken a PCR or rapid lateral flow test within the last 48 hours of attending, and they are exempt on the basis of an approved medical exemption or clinical trial participation. Please note, this clinical trial must be within the UK. Accepted proof can be any of the following: the NHS COVID pass, an approved international equivalent, or a valid text or email confirmation of a recent test result. This applies to all persons aged 18 or over. Evidence of natural immunity must not be accepted as an alternative to prove a vaccination or testing. Using verification checks on a voluntary basis. You should consider using the NHS COVID pass if you operate a venue or event where individuals are likely to stand or move around, or where individuals are in close contact, even if you are not legally obliged to do so. If you do wish to implement this on a voluntary basis, please do make contact with us and we will offer you some support to implement this. Now, many of you have been asking this of us with regards to expectations on workers within your venues and for events. We can confirm that COVID-19 status checks are not mandatory for your workers, but organisations should take reasonable steps to make sure that all adults working or providing services as an employee, contractor or volunteer in customer-facing roles show evidence of one of the following: a valid NHS COVID pass, an acceptable alternative proof of either vaccination, UK clinical trial participation, or medical exemption, or an alternative proof of a negative COVID-19 test result, for example, a text or email with confirmation from the NHS Test and Trace Service. Please do remember, as you know, that testing is crucial within the workforce. Now, validation checks. I'm sure that many of you are worried and will be faced with challenges in relation to being able to verify checks. There is a new secure, downloadable, free NHS COVID Pass Verifier app. This app is a secure way to verify individuals' NHS COVID Pass and check that they have been fully vaccinated or had a negative test result. It can also verify a domestic NHS pass with evidence of exemption or participation in a UK clinical trial. It can be used to scan a 2D barcode located within the NHS pass. A user guide is available online and we will provide you with further details afterwards. You can choose to use visual checks of the NHS COVID Pass, either through checking their app on their digital device, or for those without a device or access to the app, they may have an official COVID Pass letter. This letter is provided by the NHS 119 service or printed at home. If the letter shows a 1D barcode, you will not be able to use the Verifier app to scan the letter, and therefore should use visual checks. Visual checks can be found within a guidance document that we will provide you with afterwards. Sample letters are available to view online within this guidance. Please remember that when checking the letter, you will need to ensure that the 14 days have passed since the date of the second vaccination event. Those wishing to enter your venue or event showing alternative proof of a negative PCR test or negative rapid lateral flow test taken within the past 48 hours must have reported their test result to the NHS Test and Trace Service. A valid notification of a test result from the NHS Test and Trace Service should include all of the following: the name of the person who took the test, their age or date of birth, the date the test sample was collected or received by the test provider, confirmation that the test was either a PCR test or lateral flow test, and confirmation that the result of the test was negative. What is not accepted is the person bringing their lateral flow test kit with them, nor the use of testing on site. It has to be through the appropriate channels advised. Please note that you may on occasion allow people to enter to avoid injury or escape a risk of harm. For example, to address a medical emergency without checking their COVID-19 status. This applies to all venues and events of all sizes. Now, there is a new requirement for record keeping. For Category A premises, as a responsible person, you must produce and keep up to date a statement setting out the measures you will introduce to ensure that you are meeting the requirements of carrying out mandatory COVID-19 status checks and that you are making the public aware of your measures. For Category B, C and D events, you should explain, where applicable, your spot check approach if you have prior agreement with the local authority. Now, in addition to your Category A statement and for events B, C or D, you must also retain the following records: the date of the event or the date the record refers to for a venue, the number of people that attended the event or venue, where you've departed from your general policy statement of measures to meet certification requirements, the reasons for adopting these different measures, what measures were in fact adopted, how an individual's eligibility to enter the venue was checked, the number of occasions of attendees were varied from 100% checks by agreement with the local authority, and the number of people who were admitted on each such occasion, and also the number of occasions on which people were admitted to avoid injury or harm. If businesses are holding an event in a venue that has capacity greater than the threshold, but are not anticipating the number of attendees to meet or exceed them, they will need to produce a statement explaining how they intend to stay under the thresholds. These records must be maintained for 3 months from the date of the event, or, for a venue, the date the records refer. The local authority would have powers to request these records or policy statements within 3 working days or as part of an inspection. Please note this is a legal requirement, and should you need support in relation to these documents, please do make contact with us afterwards. Now, face coverings. In England, face coverings are now required by law in most indoor public spaces, places and on public transport, including taxis. Face coverings are not required in hospitality venues where food and drink are consumed, such as pubs, cafes and restaurants, or during exercise, such as gyms, including dancing, such as nightclubs. Where a premises or part of a premises is being used for an event where the main activities include eating, drinking and dancing, face coverings are not required. Face coverings in communal areas of the premises not being used for the event, such as in a hotel lobby where an event is taking place in a conference room. Some other venues where coverings are required are cinemas, bingo halls, theatres, concert halls and social and member clubs. The guidance provides more clarity around these venues, which we will provide within our FAQ document afterwards. Our opinion still remains, though, that we strongly advise that staff and customers wear a face covering when moving around an enclosed space, and that you consider installation of screens to tills again. Our COVID compliance grant may be able to assist you with this. The requirement to isolate for close contact with a suspected or confirmed case of the Omicron variant has now been revoked. It has now been replaced with other requirements. Now, as a reminder, if you live with or have been in contact with someone with COVID-19, you will not need to isolate if any of the following apply. If you are fully vaccinated, this means 14 days has passed since your final dose of a vaccination given by the NHS. You're under 18 years and 6 months old. You're taking part or have taken part in a COVID-19 UK vaccine trial, or if you're not able to get vaccinated for medical reasons. Even if you do not have symptoms, you're strongly advised to do the following. To do daily rapid lateral flow tests, 1 a day for 7 days, if you're fully vaccinated, to protect yourself and others from COVID-19. Please find out more about daily testing on the gov.uk website. You are also strongly advised to follow advice on how to avoid catching and spreading COVID-19 and to also consider limiting contact with people who are at higher risk from COVID-19. Please remember to continue to check your workforce vaccination status to forward plan and to encourage people to take up the offer of vaccination, including their booster jabs. Now, what the local authority will do in terms of support for the COVID-19 Plan B announcement. We will continue to update our Trade with Confidence webpage. We will also send you valuable information and issue common support as and when announcements are made. We will offer support with COVID-19 risk assessments and site visits as and where needed. And we also have, as I mentioned earlier, our COVID winter COVID compliance grant. We have been issued with new enforcement powers, including being able to issue fixed penalty notices and COVID enforcement notices, including improvement and rapid notices where necessary. They are, however, a very last resort for us here in Wolverhampton. We are taking a very light touch approach, and as before, we will engage, advise, encourage, and of course, only regulate where it is needed in extreme circumstances. We will, of course, continue to work with police colleagues and public health. Now, I'm not going to go into detail here, but here are the key priority actions and reminders detailing as to what to do in the case of an outbreak within the workforce and what priority actions are still needed of you. Please remember to review your risk assessments, provide adequate ventilation, clean more often, turn away people with COVID-19 symptoms, continue to allow people to check in your venue through the use of the NHS COVID app, encourage face coverings even where premises are exempt, and communicate and train to your staff. We have included some useful contacts and guidance documents for you, and please make contact with us, as I have mentioned, should you have any questions or concerns. We will, of course, be very happy to help you. Our Trade with Confidence page holds a wealth of information as a go-to point for you. Thank you for your time and for listening.